29th, 2021. Thank you to those of you joining us on the GBN, Grenada Broadcasting Network's Facebook page, the Grenada Broadcasting Network's YouTube channel, the website www.gbn.gd, GBN TV channel 7, 11 and 20. Good morning to the listeners of Classic 105.5, 105.9, and all the folks joining us on Party Grenada and Go to FET Facebook pages. Always a pleasure to have you tuning in. This morning I have joining me virtually are two female medical professionals, and we are here to, or let me say they are here, not we. They are here to help answer some of the questions you may have and dispel some of the myths that we may have heard in relation to COVID-19, specifically the COVID-19 vaccines that are currently available. So let's welcome, joining me this morning virtually is primary care physician Dr. Carina David and infectious disease physician Dr. Molara Alexis. Thank you very much, ladies, for joining us on the program this morning. Appreciate your appearances. Can you both hear me? Are you both hearing me?
Yes, we're hearing you well.
Okay. All right. Okay, making sure. All right. So yes, ladies, thank you very much for joining us. Before we start the program, if you can both just provide some information on who you are, your specialties, and your qualifications as we get deeper into the conversation about COVID-19 and COVID-19 vaccines.
Thank you so much for having me on the program. It's an honor. My name is Molara Alexis. I'm from St. Paul, St. George's. I went to St. George's University School of Medicine. Then I completed a residency in internal medicine at the State University of New York in Brooklyn, New York. I did a fellowship in infectious diseases in Detroit, Michigan. I worked for a stint here in the hospital here in Grenada. Presently, I work as an infectious disease physician in Southern California.
And Dr. David?
Good morning. My name is Carina David. I am a primary care physician based in Indianapolis, Indiana right now. I'm from Grenada as well. I went to St. George's University, and then I went on to do a family medicine residency at Indiana University Health in Indianapolis, where I continue to act as faculty and an attending physician at an outpatient primary care clinic there based at the University Hospital.
And how did both of you, how should I put it, became so versed in COVID-19 vaccines that you are able to share with us the information and the knowledge that you have?
It's a very good question. Happy to answer that. So I work as an infectious disease physician, and when this pandemic started in 2020, my whole world just became, not just, but it was just dominated with COVID-19, making sure that I was up to speed in the management of patients who have COVID-19. And then with the vaccination, the development of the vaccines, I had to always be up to date with how these vaccines are being developed, how effective they are, what are the possible side effects. So since this vaccination process has started, I have just been up to date, been attending conferences virtually, making sure I'm up to date in knowing what these vaccines are doing, how effective they are, what are the possible side effects. And I have just been involved at my job and also outside of my job in just speaking to people, providing information so that people could be comfortable becoming vaccinated against COVID-19.
Dr. David?
So the hospital where I am employed is the largest health system in the state of Indiana. We're also the premier referral center. So all of the sickest patients in the state that can't be treated anywhere else, they come to our hospital. And I work at the primary care practice based within that hospital. And so as you can imagine, we're also a transplant center, a cancer center, and so on. And so we do see the sickest of the sickest patients. And so obviously, unfortunately, the most vulnerable to COVID-19 as well. We have a pretty large practice. It's about 11 physicians in my practice, and we each have a patient panel of between 1,000 and 2,000 patients. And so we take care of quite a few people. And unfortunately, we have seen more COVID than you can imagine. We've been through I want to say 3 flares right now, 3 different surges of COVID-19. Unfortunately, we're just getting over the most recent one due to this Delta variant that we were seeing this summer. Thankfully, that's starting to die down just a little bit. As our practice, we have had weekly COVID huddles for the past year and a half where we update everyone on the latest research, the latest guidelines. We've been addressing vaccine hesitancy for a very long time. We've had lots of vaccine rollout programs. We deal a lot with the outpatient management of COVID-19. We work very closely with the inpatient physicians who manage those hospitalized with COVID-19. So unfortunately, I'm more versed with this than I care to be.
I know the feeling. I know you both were at post-cabinet briefing yesterday. Thanks have been expressed by the Prime Minister, the Minister of Health, and other officials. And I want to say thank you as well, because seeing the surge that Grenada is now facing, the spike in cases, you both returned home to assist as best as you can during these COVIDious times, as I call it. So I would like to join everybody to thank you for the assistance as well. So let's start with some of the concerns and some of the rumors, myths that we've been hearing, answer some of the questions, more prevalent questions in relation to COVID-19 vaccine. So I'm going to start with a kind of simple one. Why should I get vaccinated? Because we still have people who are thinking, I shouldn't get vaccinated. What I should get vaccinated for? Why should I get vaccinated?
It's a very good question. And again, we appreciate the gratitude expressed, and not just on our own behalf, but also on behalf of the other physicians and medical care professionals who are part of the organization that we are part of. Many Grenadians, doctors, and other healthcare professionals working behind the scenes, providing resources too. So we just want to also acknowledge them. But we want to say that we are promoting vaccination as medical professionals here because vaccination works. Where I work, with this surge in the Delta, we are seeing that the people who are admitted to hospitals are primarily those who are unvaccinated. So from my observation, I can see that. Here in Grenada, we are seeing the same thing, that the people who are coming into the hospital primarily are unvaccinated. And it's across the board. If you look at data coming out of Los Angeles, data coming out of New York, Jamaica, many of the other Caribbean territories, we are seeing that the efficacy of these vaccines that we have in Grenada, both AstraZeneca and Pfizer, are effective against severe COVID-19 and also death. So that's why we're promoting it from what we see and from the research that we have ahead of us here.
There are people that are saying, I don't think I should get vaccinated. I can still get it and pass it on. So what's the use? How would you respond to that?
Dr. David,
so for that one, absolutely. So for that one, I would say nothing is a perfect science. We always tout that the vaccines have, somewhere between 95 and 100% efficacy. So yes, if you do get the vaccine, there is a very small chance that you can still get COVID. But by and large, what we're seeing on the same sentiment is that those who are vaccinated just do not tend to get as sick. They vastly do not tend to get hospitalized, and death in vaccinated patients is very, very rare. Can it happen? Yes, but we just do not see it that often at all. And so why should you get vaccinated? I think it's important that we also look at vaccination not only as protecting self, but as protecting community. It goes way beyond you as an individual. It's to protect your community, your household, your country. That's what vaccination is for.
Yes, I concur. I agree with those sentiments that, because of the Delta, we are seeing, more breakthrough cases. That is correct. But the people who are getting these infections are not as sick. And then let's look at this. Suppose you have 100 people, right? You have 100 people who are vaccinated. And then maybe you have 10 breakthrough infections. we still have to think about the 90 or so who did not get infected, and because they did not get infected, they were not able to pass it on to someone else. So, if we keep focusing on, yes, there are breakthrough infections, we are going to miss the bigger picture. The bigger picture is that although we have breakthrough infections, we still have a majority who are protected from this infection. Therefore, they are not spreading the disease. And so we want to keep the bigger picture in mind when we are encouraging vaccinations.
And there has also been the comment that the authorities are insisting that we get vaccinated, and not many people are talking about building our immune system. How does that play into protecting ourselves against COVID-19, whether it's building our immune system and not getting vaccinated, building our immune system and getting vaccinated?
Great question. I am so glad you asked that, because that's something I always like to promote. I would think that I'm a pretty health conscious person. I stick with a plant-based diet. I try not to have sugar. I just get my sugar from fruit. I don't eat cakes and sweets, and it's really difficult because I like currant rolls and all these sweets and things like that. So I try to promote a plant-based diet. I stay away from sweets. I do not consume alcohol. I do not smoke cigarettes. I try to be healthy. I try to walk as much as I can, get exercise, get rest, and things like that. I believe in building the immune system. And as a physician, I believe both myself and Dr. David and all of us as physicians are saying, I heard Dr. Donald, the director, say this, and we are echoing our sentiments, that whatever we can do to build the immune system through diet, through a healthy diet, to exercise, going into the sunlight, getting vitamin D, whatever we can do, we should do it. And I am doing it. And as a physician, we are telling Grenadians, our brothers and sisters in Grenada, Carriacou, and Petit Martinique, yes, we are promoting a healthy diet. But unfortunately, a healthy diet, building the immune system alone is not going to stop the COVID-19 pandemic. There are a lot of people say, just boil this bush, drink that bush. So we have a lot of herbs and things here in Grenada. And, if there's a herb that is, safe and it can build the immune system, that's fine. But again, we have to be careful, because some of these things we don't know the doses and things like that. So I just want to say that. But again, what we're emphasizing is, although we are saying we need to be healthy, we need to build the immune system, the building of the immune system alone is not going to stop COVID-19. And I know many healthy persons I've heard of who did not do well because they felt, I'll just build my immune system. And then when COVID-19 came, they did not have a good time. Some people passed away. So although we are promoting building the immune system, we are saying that this alone will not stop COVID-19 pandemic here in Grenada or any country for that matter.
I certainly agree with Dr. Alexis. I must say she's a lot healthier than I. I unfortunately engage in a lot of the vices that she very smartly avoids. But I do share the sentiment that it's very, very important that you approach it from all aspects. Yes, it is important to eat a balanced diet, to exercise, but you have to give yourself all of the tools that you possibly can. And vaccine is a tool that we have. It's a tool that is important. One of the things that I've noticed with COVID over a year and a half of fighting it is that it's so unpredictable. You can have two patients with similar health profiles, similar past medical histories. COVID will kill one of them and the other one will be just fine. And there's no telling who it will affect in that way. We just don't know. I've had some patients who were very, very ill. They got COVID, they recovered, they were fine, nothing to show for it. I've had some patients who, in my opinion and in their opinion, were very, very healthy, no significant past medical history, otherwise doing well, and they became a victim to COVID. They ended up passing away. Why did that happen? I don't know. But with such variables, I don't think it's smart to just trust diet, to just trust exercise. Yes, you should do it, but also take advantage of all of the resources that we have. And vaccine is a safe and effective resource.
All right, ladies, let's take a break and then we're going to come back and continue the discussion. I know there are our viewers and listeners who may have questions as well, and I'd like to see if I can facilitate as many of them as I possibly can. This is To The Point. We're speaking with Doctors David and Alexis. We'll be right back.
Let's get tough on breeder larceny. It will destroy our economy. Larceny threatens our food security. Can hurt us locally, hurt us globally. To all the buyers, ask for license from all produce sellers. To all people, 300 for police for them thieving fellas. To all the farmers, please don't steal produce from your brother. Then you're selling to traffickers, hotels and street vendors. Nah, man. Let's do all we can to stop breeder larceny. New vigilance, new laws, and a tough judiciary. Stop Grenada's organized business crime. It's time.
To report breeder larceny, call 300.
There's no better way to start your day than with me on Good Morning Grenada. Good Morning Grenada is your one-stop shop. We have information, education, entertainment, your bi-weekly traffic cam, and we link up with the sister isles of Carriacou and PT Martinique. Join me every 6:35 on weekdays for Good Morning Grenada. It's your daily dose of all things Grenadian, mixed with just a little bit of crazy. Good morning, good morning. I said just a little bit of crazy. I tell all of the things that take me. Good Morning Grenada, 6:35 a.m. on weekdays, available on all GBN platforms. Start your morning off right.
Grenada's Chief Medical Officer has ordered that all confirmed positive COVID-19 individuals, their contacts, and members of their household must remain in quarantine or isolation for 14 days. Anyone who fails to comply with this order will be in breach of the Public Health COVID-19 Regulations 2020 and is guilty of an offense. Upon summary conviction, that person will be liable to a penalty of up to $10,000. A message from the Ministry of Health.
Welcome back to The Point. We are speaking with Dr. Carina David, a primary care physician, and Dr. Molara Alexis, an infectious disease physician. And this morning we are trying to answer some of the questions and concerns you may have in relation to COVID-19, specifically the vaccines. Speaking of the vaccines, ladies, one of the concerns and questions that we hear coming up still almost 2 years later is that how come the COVID-19 vaccines have been developed so quickly? They started being used, they were not, what was it again? They were not fully approved, but they were approved for emergency use, and some people didn't trust that. And some people were saying that they were still in trial stages. So there were a lot of things about how quick but these vaccines have come up. How would you reply to Dr. Alexis? You're slanted now. You're sideways, I mean. I don't know why. I don't know what just happened. There we go. Lovely. Yes, so what would you say about the quickness of the development of the vaccines?
So the base, as you had, just inferred, the technology is not new. For example, this is the first time we have an mRNA vaccine, of which Pfizer is, but the technology is not new. So it had been studied for years. It had been studied for years before. So it wasn't like in 2019, someone said, oh, let's see what mRNA vaccine is all about. The technology had already been in the pipeline. So with the pandemic now, we just had to build on it and say, okay, we have this technology, let's put it into place. The viral vector vaccine, of which AstraZeneca is, again, this is not new, because it is interesting to note that there was an Ebola vaccine that had been FDA approved that has the same technology as the AstraZeneca vaccine. So again, the AstraZeneca vaccine is not the first viral vector vaccine. We have had an Ebola vaccine that has been FDA authorized already. And although Pfizer is the first mRNA vaccine, the technology behind it is not new. So the technology was there and it was built on. The second thing is that the technology is faster. The technology to make an mRNA vaccine, for example, is much faster than the regular vaccines we've had in the past, where you have to get the virus, you have to kill it or weaken it and multiply this process. So one, the technology is not new. Two, the technology is a faster technology. And these are some of the important points that would help us to understand. Again, in a pandemic, we have all the scientists working together. It's not like the scientists in Germany are working on one thing, the scientists in England, the other thing, the scientists in America. Everybody is working on getting vaccines out. So this again helps us to understand that everyone, all hands on deck to get the vaccine. And again, the phases. So before you can have vaccines authorized for use, you have to do 3 stages or 3 phases. Phase 1, phase 2, phase 3, where they look to see if these vaccines are safe and if they're effective. Normally you do phase 1, then 2, then 3. But because of the emergency of the COVID-19 pandemic, the phases were overlapped. So they did phase 1 and 2 together and phase 2 and 3 together. So they did not cut corners in saying, okay, we're not going to make sure they're very effective. They're just saying we're going to overlap the phases. So again, the technology was there before. It's a faster technology. It's a multinational effort where all hands are on deck in all the nations getting these vaccines out. And fourthly, the phases were overlapped. They weren't done one after the next, but they were overlapped.
Okay, first time I'm hearing about the overlapping of the phases. Okay, understood. Let's kind of compare both vaccines. Well, not both. In Grenada, currently, we have both AstraZeneca and the Pfizer-BioNTech available. And there are people who are wondering, which one should I get? Which one, for lack of a better phrase, is better? Can you just maybe compare or contrast them as best as you can, so people who are still trying to make up their minds and still trying to decide, they can better have an understanding of what to expect with both?
Yeah, that's a very good question. I was at the vaccine clinic and someone asked that question, which one do you think I should get? Public Health England, June the 14th, 2021, they published some data looking at the efficacy of both the Pfizer vaccine and the AstraZeneca vaccine. And from their data, both with Pfizer and AstraZeneca, they had, the percentage was in the 90s. Pfizer about 96, AstraZeneca 92, the efficacy of the vaccines against hospitalization. In other words, both the Pfizer and AstraZeneca vaccines, from this data from Public Health England, we are seeing they are about in the 90s. The efficacy rates are in the 90s in preventing severe hospitalization. So to answer that question, I would say both vaccines are effective in preventing hospitalizations, in preventing severe COVID.
What about the side effects of both vaccines? Are they the same or do they differ?
Okay. I'm thinking Dr. David would just kind of mention the common side effects of vaccines, and maybe I could talk about specifically AstraZeneca and some of the side effects that people are concerned about, and also myocarditis with Pfizer.
Absolutely. So side effects of vaccines, they're pretty unanimous across the board, regardless of which vaccine we're talking about. What happens is when you get the vaccine, you create a strong immunologic response. So your body is creating those antibodies. So what we expect to see, and what I've seen very commonly in my clinical practice and what I've experienced myself, is within the 24 to 72 hours after getting that vaccine, you may experience some low-grade temperatures. So not quite mounting a fever, but feeling a little hot. You may experience some muscle aches and pains, some headaches. I've had rare reports of nausea, vomiting, diarrhea, but all of these symptoms tend to be very mild, and then they go away, usually without any intervention at all, within 1 to 3 days, mostly within a day. For me, I had no side effects with the first dose. With the second dose, I did feel pretty run down for about a day. And then with the third dose, I was absolutely fine.
And which
so
one did you
everybody's
get?
going to differ.
Which vaccine
Sorry,
did you
what was
get?
that?
Which vaccine?
Which vaccine?
Yeah.
I got the Pfizer vaccine. I got the Pfizer vaccine because that is what was available to me. As I always tell my patients, if I get a call saying a vaccine is available, I will take whichever one is available because they all have similar efficacy. It does not matter to me which vaccinations my patients take because all of their efficacy profiles are about the same. And a vaccine is better than no vaccine. And I just got the Pfizer because that is what was available to me at the time. But it is generally very well tolerated. In our practice with a patient population of almost 20,000 people, we have had 0 patients admitted to the hospital with vaccine side effects. Some people may have mild allergic reactions, which we see, which is well reported, but that typically goes over just fine. And the symptoms typically pass within a day to 3. So I would not worry about vaccination side effects per se.
Yes, that's true. Yeah, some people say when I got the vaccine, I thought I got COVID. But as Dr. David pointed out, the symptoms you get are like flu-like symptoms. So that's why some people think that. So just to continue to add to that. So we do know that with the mRNA vaccines, of which we have Moderna and Pfizer, we do not have Moderna in Grenada, but we do have Pfizer. But there appears to be a link between the Pfizer vaccine and myocarditis and pericarditis. So there's a sac around the heart called the pericardium. If that's inflamed, it's called pericarditis. If the heart muscle itself is inflamed, that's myocarditis, inflammation. And so there have been cases of myocarditis with the Pfizer vaccine, but these are very rare. So for example, for every 100,000 persons that gets this vaccine, about 2.5 would get myocarditis. So the population of Grenada is just a little over 100,000. So that means, it's if you look at the entire population of Grenada, roughly just 2.5. But to put it in perspective, what we have to understand is that with COVID-19, you can get myocarditis too. And the rate of myocarditis with COVID-19 is 11 to 100,000. So again, if 100,000 persons get COVID, about 11 of them would get this myocarditis. With the Pfizer vaccine, the rate is much lower. So although you have this side effect, it's much, much lower. And we always need to put things into perspective. We see what's going on here in Grenada, how COVID is just moving through the population. It's causing death. It's causing people to end up in the hospital. We are seeing it. And we have not yet heard of any side effect here in Grenada related to the Pfizer. So although we acknowledge it's a side effect, we are saying the rate is much lower. And that's why we are saying it's safer to get the vaccination with Pfizer than to run the risk of getting COVID, ending up in the ICU, ending up in the hospital, spreading it to someone. So we want to point that out. With the viral vector vaccines, of which Janssen, we don't have that in Grenada, but we have the AstraZeneca. There has been an association with blood clots. We have had that. But again, the rate of blood clots with the AstraZeneca is much lower than with COVID-19. As an infectious disease physician, I have seen several patients admitted to the hospitals. They have had blood clots in their legs, blood clots in their lungs, blood clots in their head leading to strokes, blood clots going to the heart leading to heart attack. So in essence, it's more dangerous to get COVID-19 because you would more likely get a blood clot with COVID-19 than you would with the AstraZeneca vaccine or the Janssen vaccine. So we are not denying that there is this rare possibility, but it's much lower than with COVID. And so again, we have seen the number of persons who have, succumbed to COVID-19, who have ended up in the hospital due to COVID-19, and that's much higher than with the very rare rate of having a blood clot. Again, people talk about paralysis, the rate of having this syndrome called Guillain-Barré, where you can have weakness and paralysis. It's there, but it's much lower the rate of the possibility of getting this from the AstraZeneca vaccine, from a viral vector vaccine, is much lower than getting sick and passing away with COVID-19. So we have to weigh the benefits and the risk.
I have a young lady who she got her first dose of AstraZeneca vaccine. But she has not taken her second one, which was due since July, because her concern was, or her reasoning is, I don't want to get the second dose because I want to have children. Is that a concern that we, or have we seen that instance of people who have gotten vaccinated are unable to have children, as well as how does it affect, or should pregnant and lactating mothers get vaccinated? And the concerns and research in relation to how getting vaccinated affects your menstrual cycle.
So as I spoke to this yesterday, no, there is no evidence that any of the COVID vaccines affects fertility. So we should not be concerned about that, either female or male fertility. It's relatively common when females undergo a significant life stressor, whether that is a physical stressor, an emotional stressor. You can have what we call secondary amenorrhea. That's where your periods become irregular after a long period of them being regular. This can happen after a big life event, like death of a family member, something like that. It can happen after you were very, very ill, hospitalized for some reason. It's relatively common. I don't see it too often, but often enough that it's widely recognized. When you get the COVID vaccine, that is considered a minor stressor on your body, that immunologic response when you're building up those antibodies. So it is possible that throws off the menstrual cycle for a little while. But what I have seen, what we have all seen, is that sorts itself out without any intervention. Your periods will return to normal. We haven't seen any well-documented cases of infertility as a result of the vaccine. In fact, the risk of not getting the vaccine is much higher than the risk of getting it. So I implore anybody whose concerns is fertility, go ahead and get the vaccine. With regards to lactating and pregnant mothers, in fact, we have seen, or we're hopeful that there are benefits for lactating mothers getting the vaccine, because it's well documented that some of these antibodies can be passed into the breast milk, and then your baby can get protection against COVID-19. Because as we know, the vaccine's unauthorized for use in young children. And so that's an excellent way to offer some presumed protection to your child. So yes, I would definitely recommend it to all lactating mothers. I myself got all 3 doses while lactating, and my baby is fine, happy, chunky, healthy, no issues. I have several friends who got the vaccine while pregnant, several friends in healthcare, ranging from first trimester all the way through to 3rd trimester. All of their babies were born totally fine, totally healthy. In fact, it's a general recommendation amongst most of the colleges of gynecology, the gynecologic associations, that pregnant women go ahead and get the vaccination, because the risk of preterm labor, should you get COVID-19, is quite high. Your risk of ICU admission, your risk of death with COVID-19 is elevated, just because pregnancy in and of itself suppresses the immune system a little bit. And so we recommend that you give yourself all the protections that you can, not only for yourself, but for the child as well. So yes, all of those populations should proceed with the vaccination.
Yes, yeah, definitely. Yeah, to echo that, as you said, the American College of Obstetricians and Gynecologists, the Society for Maternal and Fetal Medicine are encouraging women to go ahead and get vaccinated. Again, a study came out of St. George's University in London, that's in London, and they were looking at pregnant women who had received the Pfizer, the AstraZeneca, the Pfizer, Moderna, and AstraZeneca. Granted, in this study, most of the patients did have their Moderna and Pfizer. A smaller percentage did have AstraZeneca. So I just want to put it out there, a smaller percentage did have AstraZeneca. But in this study coming out August 2021, they did not see any anything that would indicate that taking the vaccine would put you at higher risk for stillbirths, the baby coming out too small, the baby having any abnormalities. We have no evidence of that, taking the vaccine will cause this. Again, another study coming out of the New England Journal looking at a little over 35,000 women. Again, they did not see any obvious signals. I want to say that was with the Pfizer vaccine, any obvious signals that, taking the vaccine would cause a problem. That's why these societies are recommending go ahead and get the vaccines, because if you are pregnant and you get the COVID, it increases your rate of the mother dying, the child dying, the mother getting preeclampsia, that's high blood pressure in pregnancy, the mother getting eclampsia, that's seizures in pregnancy. And so it's safer to go with the vaccines at this moment than to take that chance with COVID, even in pregnancy and breastfeeding.
All right, let me see how many questions I can facilitate from our viewers and listeners. Landline number 435-2041. WhatsApp number is also 435-2041. Only written messages on WhatsApp. Post your questions on Facebook and YouTube as well. Good morning, caller.
Yes, morning. Morning to everyone. Docs, morning. It is proven historically, the statistics show that more people survive COVID even before the vaccine came out than who died. After the vaccine came out, it is now an established process that if it is proven that you have the virus when you go to do the test, they don't give you the vaccine. That is a big question. On top of that, you have people sent home when it's proven that they have the virus after the test. They are sent home to either sit and die, or they will recover, and more have been recovering than who died. Now, in the given situation, it is understood in science that when you fight a virus, your body develops immunity to it. So then why is it even after you have recovered from having had the virus, they expect you now to still go and take the vaccine when your body would have expectedly developed an immunity to it? The whole thing doesn't sound correct and right to people who are thinking. And I think I'm speaking for those who are thinking relative to such a thing. So I need for you all to answer that, please.
Thank you very much, caller.
Thank you, sir. That's a great question. Why are we encouraging vaccination after you have COVID-19? So fortunately, after you get the COVID-19, there is a bit of protection. We do agree to that. But what we are seeing is that, one, especially people who have mild COVID and COVID without symptoms, the protection that their body offers. So we are saying if you have COVID with mild symptoms and no symptoms, we are seeing that the protection that your body generates and offers is not as good as the protection you get from vaccination. Now, if you get the severe case where you end up in the ICU, you're sick, that protection may be a little better. So why we're encouraging vaccination even after infection is that, one, we're not entirely sure how long that natural protection lasts. Two, the protection that your body generates, especially if you have no symptoms or mild symptoms or moderate symptoms, is not as good as vaccination. And where I work in California, I see patients who have had COVID before coming in again with COVID. So it tells us that the protection, unfortunately, from natural infection is lacking, maybe due to the duration of when they had the first infection, or maybe their first infection was mild, so the body didn't mount as good a response. So again, we are seeing people, first infection coming in again with second infection. It could be related to the fact that the body did not mount a good enough response, or two, that the duration of time between the first and second, the protection wanes. So that's the answer to that. Also, to answer the point about, if I heard you correctly, if they test positive, do they get the vaccine? If I'm not interpreting you let me know. So when you test positive for COVID, the vaccine is not a treatment. So if you are positive, you don't get the vaccine. After you've recovered and you come out of isolation, that's when you get the vaccine, because the vaccine is not a treatment for COVID.
Right. WhatsApp. Somebody on WhatsApp says much emphasis is placed on covering mouths and nose. I'm not hearing about eyes. How concerned are the doctors about spreading through the eyes, or how much of a risk of getting COVID through the eyes?
It's a great question. So particularly in a context where you have aerosols being sprayed, you need eye protection. So example, working in a healthcare setting, when I go to see patients, I have goggles. So I have my goggles right here because there's a risk, for example, if you're giving patients a breathing treatment or if they're on certain kind of machines like BiPAP oxygen machines, things can spray. So in these settings, eyewear protection is recommended. When you're in an instance where you can have spraying or splashing and things like that, some eyewear protection could be recommended. When I traveled to Grenada, I was in close quarters because if you're in a plane, you're in the airport, I can't do 6 feet social distances. So me personally, where I'm in places where I can't do the 6 feet distancing, I take the extra precautions of wearing a goggles. But, in the general environment, you're walking down the street, you have your mask, it's covering your face, it's covering your nose, your mouth, you're doing your 6 feet distances, that's fine. There are instances where goggles are needed, particularly if you're in a work environment, maybe if you're in an environment where you can't do your 6 feet distances, taking that extra precaution may be good and necessary.
And how soon after an infection do you have to wait before you get the vaccine?
Okay, so the CDC says that when somebody comes out of isolation, so if you have mild symptoms or no symptoms, generally 10 to 14 days you're out of isolation. So as soon as you come out of isolation, you can get the vaccine. However, because your body generally may have some kind of protection, you can wait around. I know in Grenada, it's generally about a month out of the infection, you can get the vaccine, But if somebody 2 weeks after they have recovered, if they want to take the vaccine, that's okay too. So the CDC recommends as long as you're out, you have met the criteria, if you have mild, moderate, in about 14 days, you normally meet that criteria. Now, if you're in the hospital or because you have severe COVID, you're on a vent, or if you're immunocompromised, in some instances, your isolation period is longer. But generally, when you're recovered, you can take it.
Good morning, caller.
Good morning. How are you guys this morning?
We're good.
Okay, after all being said and done, you got a COVID back control, and the place may come to I would not say full, but to some sort of normality. I hope there is proper measures in place of no leniency, like, you will not be lenient to anyone of having any form of large gathering in spite of what the vaccination, because you still don't know how far you will be going with this, how safe will it be. But at times we all know that politics come to play. As at times we know that you are vaccinated, so you could have you could have an event of showing your card and whatnot. But how safe it is? Because we all know business has to go on, but why should we put people at risk for a business, at that level to go on, like kind of like atmosphere, yeah? Because all the time you caution people not to do this, and that is the time when you start cautioning people, that's the thing that people go behind.
So just to understand, caller, how safe is it to have vaccinated people, like a vaccinated event, fully vaccinated event? That's what you're asking? Yeah,
because you see, we still at times we say it like that. For example, we had cricket, and we don't have any much evidence of it, but there were people in there who was not vaccinated.
No, I think you're wrong with that part. But okay, I understand the question. Thank you.
I don't want to. I know how media is, right?
Thank you, caller. All right. Okay. Thank you, caller. So the caller is really asking. You heard the question? How safe is it to have fully vaccinated events? Like if I have a little party, but only for fully vaccinated people, is that a safe activity to have?
So I think we have to look at the general picture. We have to look and see, I'm assuming we're talking about after this surge is under control. I'm assuming that. I'm not thinking we're talking about now because we're not having any gatherings right now.
Correct.
So you know what the authorities will do, the chief medical officer and his advisors and all the people, what they will do, they will look and see, the vaccination rates, people who have been vaccinated. They will look at the prevalence or the level of COVID-19 in the community, and then that's when restrictions will be able to be lifted. And that's what was done in different states. For example, in California now, after a certain, the level of vaccination was at a certain rate, and there was a marked decrease in COVID-19, that's when it was said, okay, you can now do this, you can now do this, and so forth. But then, unfortunately, we had to revert some of those things because the Delta came along. So it's a very moving target. The authorities would look to see how many people are vaccinated, the level of COVID in the community, what's happening, and then they will make recommendations.
All right, let me see if I can get a question on the YouTube. Somebody is asking, where is it? Can you tell us how, as soon as I read it, the person deleted the comment. All right, let me see if I get another one on WhatsApp. Somebody says, how are we sure that the doctors are telling us the truth and not selling us out to big pharmaceutical companies?
All right, Dr. David, you want to jump on that one first, and I'm a follow-up.
I'm not sure how to prove it to you, but I can guarantee you that I received no kickbacks from big pharma, as they call them. I wouldn't know how to go about doing that. But no, we do this, I would say, from the goodness of our hearts, from a deep sense of duty. We're not selling you out to anybody. We don't belong to any pharmaceutical companies. We don't belong to any government organizations, not even to our employers. We follow best evidence. We follow the data, we follow the science. There are no external influencing factors. If I could prove it to you, I would, but unfortunately, I am not sure how. You'll just have to take my word for it that I am acting on behalf of no one but myself and out of the love of my country and my people.
Yeah, definitely. I'll say the same. I'm not associated with any pharmaceutical company. I don't get a commission. No one has sent me here to promote their brand of vaccine or anything like that. I am doing that out of the goodness of my heart as a human being and as a Grenadian, just to share what really works. Just as I would advise maybe a diabetic to take insulin, or I would advise somebody with a heart condition with fluid overload to take a diuretic, in such a manner. I'm not getting money from advising people to take insulin or diuretics. I am saying I've looked at the evidence, I've seen it with my eyes, I've read the documents that vaccination works. My first loyalty is to God. I'm not going to be coming on any public platform to lie. So again, as Dr. David said, you have my word, and I know you believe in what I'm saying when I'm honestly telling you I am not receiving a cent for coming here to see this.
Booster shots. Does everybody need to get a booster shot? Does it depend on the vaccine? And somebody on WhatsApp is asking, after being naturally infected by COVID, do you need to get 1 or 2 shots of the vaccine if you were not vaccinated before that? And Dr. David, I know you spoke of getting your 3rd Pfizer shot as well. So does everybody have to take the booster shot? When do you need to get booster? If you're afraid of needles, do you need the booster?
On the booster shot, there is no decision as yet, unfortunately. No solid FDA recommendation, at least for the U.S. Right now. The FDA had a recent meeting, and I know Dr. Alexis has more information on that, where they did recommend it for those 65 and older and for those with immunocompromising conditions. And then the CDC director went out and she further stated that those with increased occupational exposures, such as healthcare workers and so on, should go ahead and get that booster. But in terms of the data, it is still coming in. This is a new evolution. I really think that the focus right now should be on making sure that as many people as possible get the first 2 doses of their vaccines. I think we're still a way out from booster, especially here in Grenada. And so I think speaking on that right now is a little bit premature. As for previously infected patients, we do recommend that they still go ahead and get both doses of the vaccine, not just one.
That's right. I concur. I agree.
All right. Somebody, hold on. Let me see. Landline? No. Somebody on WhatsApp ask lies. Landline.
I just wanted to add regarding the AstraZeneca, so that data is for Pfizer coming out of the US and their recommendations. Currently, there are studies being done on the AstraZeneca, and we will get that data as it comes to hand. So as Dr. David said, our focus should be right now on getting our first and second vaccines. Those who are fully vaccinated with AstraZeneca, congratulations. I'm sure word would be coming out soon about additional doses or booster doses.
Good morning, caller.
Good morning. I have a question for the doctors. Now, my mother is 95. 30 years ago, she was diagnosed with MS. She's paralyzed from her waist down. She doesn't walk. She's bedridden. She's blind. And I'm debating, should I give her the shots or not? I am fully vaccinated. Her caregiver is fully vaccinated. We don't go out. We stay at home. We try to do all the protocols, but I'm in a limbo. I don't know whether I should give her or not. She's 95. I mean, she have everything. Nobody can come on visit. She wants a mask. She's well alert because I inform her of everything. But I am just so skeptical of giving her that needle. So could I get some advice from the doctors?
Thank you very much, caller. Docs?
So my recommendation would be... Sorry, go ahead, Dr. Alexis.
No, go ahead. No, please go ahead. Sorry about that.
So my recommendation would be yes. Unfortunately, mom fits into the exact criteria that we do tend to see severe disease and rapid decompensation. Fortunately, the comorbidities that you mentioned, although it might not be the entire list, but what you did mention, none of those preclude her from getting the vaccine. Whether it's the MS, the paralysis, the advanced age, and so on, she still meets criteria based on those things. Given her age, given her comorbidities, I do think that she is one of those who should be first in line to get the vaccine because she is very high risk for severe complications from COVID. So yes, I would have an unreserved yes recommendation for that.
I agree with that. I can't add anything to that. Perfectly said.
Okay, the WhatsApp question. What are the doctor's feedback on temperature testing by many businesses on the wrist or the hand? In my experience, a fever infected person is in the head area and a wrist test seems ineffective.
Unfortunately, I'm not up to date on the data on which part of the body is the best to test for the fever, but I do not believe that fevers present primarily in the head or versus a wrist or anything. I think we can check the temperature. While central will likely be better, I think something is better than nothing. So I don't have that up-to-date data on the efficacy of that exact type of screening on me, unfortunately. So I can't speak to that accurately, at least. Anything I say would be opinion, and I'd rather not give that.
Yeah, I think I'm with you on that too. As you said, fever tends to be generally not just in one point, so you should get it from the wrist. But I have not seen any data that says that, there's a high rate of error if you take it on the wrist.
All right, let me see if I can get to some WhatsApp. It's almost time for us to end the program, but there's so many questions. Goodness. All right, so somebody on WhatsApp asks, what can the doctor tell us about the Cuban vaccines? Because there are a lot of people waiting on the Cuban vaccine.
So I have not studied into the Cuban vaccines, and what I want to say about Cuba is that Cuba has been a strong supporter of healthcare in Grenada, and we are so grateful to Cuba. But I cannot speak to the Cuban vaccine because I've not studied into it. But what I want to say is that don't wait on the Cuban vaccine. I was trying to remember the proverb that we normally say about taking what's before you now. I can't remember it, but we have AstraZeneca, we have Pfizer. let's take it and not just wait on something that's to come. And we do appreciate Cuba and their efforts to support healthcare, not just now, but Cuba has been a supporter of healthcare in Grenada, and we're grateful for that. But let's take what we have before us and not just wait for something. Yes, that's the problem. Hogs say bathe in the first water, which means whatever water is before you, bathe in that and don't wait for some other pool down the road.
I haven't heard that in so long.
Yes, bathe in the first water.
All right, WhatsApp. Hold on, Joseph. Somebody on WhatsApp asks, can you tell us how effective is the AstraZeneca vaccine against Delta and other variants in light of all the negative information being shared?
Thank you again. Let me look on I was reading some research, again, coming from Public Health England, June the 4th, and they were looking at people who were hospitalized from April the 12th to June the 4th over there in the United Kingdom. And in that period of time, that's where you had the Delta variant. And the AstraZeneca, 92% efficacy against hospitalization. So even in the age of the Delta, AstraZeneca is still running like a king. And so we are saying that AstraZeneca is effective in reducing severe COVID and hospitalizations. So I just wanted to point that out.
Any data on its efficacy with Pfizer's efficacy with Delta?
Yes. Oh, yes, much of it. So here we have, in that same one from Public Health England, it was 96% effective against hospitalizations. There was another report from CDC Morbidity and Mortality. This just gave general, so it didn't like tease out if it was AstraZeneca, if it was Moderna, if it was what the vaccine was. But listen to this. In the vaccinated folks, the risk of going to the ICU was 3.2%. And on the unvaccinated, that was 7.6%. So in other words, if you look at gross numbers, fourth of the people who got the COVID, 4,312 were hospitalized because they were unvaccinated, but the unvaccinated was just 1,000 and so. So this is showing that the vaccination process is working. This one doesn't tease out which one is AstraZeneca or Pfizer, but the one from Public Health England does. There was one from New England Journal that looked at the effectiveness of COVID-19 vaccines in the age of Delta. They did note that because of the Delta, the efficacy was a bit lower. Their percentage was about 88% for Pfizer. But even though it goes down, it's still very effective because efficacy of 80-something% is still very good. So we are here saying that even if you see the numbers going down, let's not say, okay, I'm not going to take the vaccine, it's going down. It's still good protection. And you know what? If people continue to resist vaccination, what may happen is that we continue to get more and more variants, even more deadly than the Delta. So we are promoting vaccination, not just for the Delta, but because we know that if we don't get this pandemic under control, we can get another variant more deadly than Delta. So let's hurry up and get vaccinated so we can get it under control, so we can stop these variants. We don't want another variant more deadly than Delta.
And the final question that we would have time for, somebody says, I have a daughter who has a kidney problem. What are her chances of getting vaccinated and which one should she choose? And somebody on Facebook asks, if you have a pacemaker, can you take the vaccine?
Let's go for that, Dr. David.
Yes. So kidney disease is not an eliminating factor. Yes, she should. I unfortunately did not get more information as to the nature of her kidney disease, but I can confidently say, regardless of the nature of the kidney disease, she can go ahead and get vaccinated. Chronic kidney disease is one of those pre-existing conditions that we do see increases your risk of severe disease. So yes, she should go ahead and get it. And in terms of which one she can get, as Dr. Alexis stated, both of them highly effective. So whichever one is available to her is the one that she should go ahead and get. In terms of pacemaker, yes, I have several patients with pacemakers, all of whom have tolerated their vaccines flawlessly. Having a pacemaker is not, again, an eliminating factor. You should go ahead and get it.
Definitely. And we want to include that for diabetes, high blood pressure, lung disease like asthma. We want to include that for heart disease, heart failure. If you had a heart attack, if you have a lot of people ask about sickle cell, thyroid disease, stroke, all of these conditions. These people should be first in line to get the vaccine. Both AstraZeneca and Pfizer. Here I'm seeing the article that I was looking for coming out of the New England Journal of Medicine saying that the 2 doses of AstraZeneca and Pfizer are highly effective against the Delta variant. Not as effective as the first variants before, but they are still effective. Whatever we have, let's take it. Let's take it and thank God for providing these vaccines so we can get out of the pandemic. And we are thankful for God for protection thus far.
I'll just like to restate what I mentioned yesterday. Really, the only precluding factor that we see, of course, speak to your doctor if you have any concerns, but really the only across the board precluding factor that we see is if you had a very severe allergic reaction to the first dose or any of the ingredients of the vaccine, which again, very, very rare. Again, in my patient population of well over 1,000 patients, I have only seen one anaphylactic response to the first dose. And so she did not go on to get her second dose. Everyone else has tolerated it fine in my experience. So really only severe allergic reaction to the first dose is what you should truly be concerned about in not getting the vaccine.
That's correct. Severe allergies, or if you have an immediate reaction within the first 4 hours or so. But other than that, some people say, I'm allergic to insulin, I'm allergic to metformin, I'm allergic to some other medication. You do mention it to your healthcare provider. If you're allergic to an injectable or so, you could mention that. Maybe they can monitor you a little a little more closely, but these are not reasons why you cannot get the vaccine if you're allergic to maybe metformin or some amlodipine or something like that.
Docs, I know I have to let you. You're both with the General Hospital. So in your closing statements, I'm just going to ask this final question. One of the concerns we've heard from officials here, and I think you both mentioned it yesterday in postcab, that some people are waiting too long before they seek additional attention, and we sometimes have fatal outcomes from that. But the question is, when do I know it's time to seek medical care at the hospital or at a health facility? At what point should I say, okay, this is too much? Because that could be one of the things that they're not able to realize, that now is the time.
So as I've been telling my patients in the outpatient setting, things that you want to seek emergency care for, let me preclude that by saying, if you ever have any concerns at all, if you're wondering, man, should I go to the hospital? The answer to that question is likely yes. Better to go and be treated and released and be safe at home than to sit down at home just wondering until it's too late. If you really don't want to go, but you're still concerned, call your healthcare provider, call a healthcare professional and ask. But the symptoms that I typically send my patients for, if you feel like you're having shortness of breath, that's quite a concerning one. So a shortness of breath where you feel like any breath that you take just isn't quite good enough, like you feel like you're breathing through a straw, you want to seek care for that. If you have an unrelenting fever that is not responsive to any of the over-the-counter agents like Panadol or so on, then yes, if your fever is not responsive, you want to go in. If you have severe chest pain, we call it substernal chest pain. So right in the middle of the chest, it just feels like an elephant sitting on your chest. You want to go into the hospital for that. If you're feeling weak, like you can no longer walk, you can no longer get up and complete your daily activities without feeling just too weak and too short of breath, you want to go in for that. If you find you're not making as much urine as you typically do, so usually you'll pee 4 times by now, but you haven't gone to the bathroom at all, that's a reason to go in and seek care. That's a sign of pretty severe dehydration and possibly even kidney damage. There's a wide array of reasons why you should seek care, and I implore you to speak to a healthcare professional. But truly, the ones that we really are concerned about are going to be those shortness of breath symptoms and the severe weakness. Any changes in cognition, so if you're getting confused, you're having word finding difficulties, you find you're not really understanding what other people are saying, that can be a sign of really low oxygen levels. We want you to go in for that as well.
Yeah, definitely. I concur with that. The confusion, like you feel like you're getting a stroke, you can't breathe. If you're getting severe chest pain, I know sometimes with a cough you get chest pain, but if you're having severe chest pain, it's better you come and it be told you, okay, that's okay, then it's something else that could be related to a blood clot from COVID or so. So if you're getting, as Dr. David said, severe shortness of breath, if you're getting chest pain, if you're getting confusion, passing out, as a matter of fact, anything that it's better to come and then we evaluate you and say, it's okay, you can go home, than to stay too late and things don't turn out well for you.
Thank you very much, ladies. I'll let you get back to your patients and the facilities. Appreciate it once again. Thank you to you and all the other medical professionals who are here helping us get through this COVID wave. Hopefully, it'll be over in short order and we can at least get back to some form of normalcy. So once again, thank you to you both. Any final words you'd like to share?
Well, thank you. Thank you for having me on the program. Thank you to our listeners who have called in to ask questions. We appreciate that. We just want to, again, encourage you with vaccinations. Vaccination is the way to end this pandemic. Again, build your immune system with what you can. We need to wear masks and so, but we are promoting vaccination. Let's stick with the science. Let's stick with the accuracy. There's a lot of, false information, Dr. Google and different things like that. Let's stick with the science and believe that we can get out of this pandemic as we do our best with God's grace. God's blessing to you all, our beloved brothers and sisters in this tri-island state of Grenada, Carriacou, and Petit Madney. God bless.
I share the sentiments. I don't really have much to add. Thank you so much for having us. Please, if you have any questions, reach out to your healthcare professionals, reach out to us, and please take the information from us, not from Dr. Facebook or Dr. Google.
Yes.
If you have any questions, reach out. Thank you so much for having us and happy to help however we can, whenever we can.
Thank you very much.
Indeed.
You both stay safe, and we appreciate your being here. Thank you very much. Have a good day.
Thank you. God's blessing to everyone. Bye-bye.
Thank you.
Infectious disease physician Dr. Molara Alexis and primary care physician Dr. Carina David. We thank them both here helping us get through these COVIDious times as we go through this wave of the pandemic. We thank them both. I see comments and questions asking about their relations to some of our known Grenadians, and all I would say is yes, they are related. That should answer those of you who have the question. It's time for me to head on out. Joseph has been here and very patient. Thank you very much, Joseph, for your patience as we get these questions answered. It's time for me to head on home. I'll be back tomorrow morning, God willing. Joseph is up next with Mid-Morning Buzz. Have yourselves a blessed, enjoyable, wonderful Wednesday. Observe the protocols and stay safe.